Welcome to Tama Talks, very first segment. I'm Tama. I'm a nurse practitioner. I've been practicing for 13 years, and in this space we'll speak all things aesthetics, beauty, fashion, style, wellness, and health. And today's topic is, it's a hot topic, facial injectables like Botox and fillers and their effects on mental health. I'm super excited. My guest is Dr. Bryan. She's a psychotherapist, and her specialty is mental health, depression, anxiety, ADHD, trauma, abuse, and addiction.
Yes.
Thank you for coming.
Yes, I'm glad to be here. Thank you for having me.
Yeah. So we're going to find out all these things about mental health with you today, okay? People get Botox regularly because they want to feel confident, they want to look polished, they have a sales job, they want to, close the deal, so they want to look nice and they want to be competitive with their colleagues. So they get Botox and fillers. And then, during COVID, there are a lot of people who are wanting to get on the Zoom call. So of course they see themselves on the camera and they'll see little imperfections, and it really bothers them. So these are things that I can help them with, to give them a little more confidence, to help them look a little bit more polished. You've had regular Botox and fillers, right?
Yes.
And does it make you feel more confident in your appearance and your mental status and your mental health? Tell me your experience about that.
Yes, it does. It does. We all want to present our best foot forward, so to speak. We always want to look good, look our best. And if Botox can help you achieve that, absolutely. Mm-hmm. Absolutely. Yes, I've been getting it now for how long?
I won't share your secret
okay.
unless you want to.
A few years. Okay. But yes. Yeah. And it does help. You mentioned, the pandemic mm-hmm. and what happened during that. And we found then that research actually shows that during that process, self-care became very important. Mm-hmm. And part of self-care is, facial fillers and Botox was included in that.
Yeah.
And we found that did increase our self-esteem.
Because of the Zoom calls and things like that. So you are forced to look at yourself, and we're our worst critic. We see little fine lines, little skin imperfections, a little pore, and then it bothers us so much.
That's why there's been a surge in ring lights also mm-hmm. being online. So
and
yes,
filters
we do.
and
you do.
Yeah.
You see every imperfection. You do.
Yeah. And then, there's misconceptions about Botox. People think that if you get it, it makes you look unnatural, frozen, and then the moment you stop using it, you will have more wrinkles. Well, that's not true. The drug, as you know, stops the movement for 3 months. During those times, the dynamic movements are softened, and then so those wrinkles never get etched in, mm-hmm. And they become permanent. So, it works for 3 months. I make an analogy to people. Whenever you come in, you turn on the light, you need all the power to turn on the switch. It just doesn't turn on for half of the power. Mm-hmm. So that's another misconception. And there was a twin study. I think Allergan did the twin study of a set of identical twins. One twin gets regular Botox for a span of 13 years, and the other does not. Well, guess what? The one who gets regular treatments has no lines or wrinkles, and the other one does. So, but we know that.
Yeah. Yes.
Unfortunately, it only lasts 3 months, so you have to get regular treatments.
You do. Maintenance is important.
Yeah. And sometimes people come in and they would, they've never had Botox before. So they would ask for like a lower dose. But, typically 20 units is for the glabella, or 50 units for the glabella. Well, you can't just do half of that. It won't work. It's like antibiotics. You can't take it for just 2 days. You have to take a whole course for 7 days, So these are people that are opposing the treatment. Do you find in your clinic that people oppose psychotherapy?
Usually, when someone needs or wants mental health, they want to be there. Occasionally, you'll find maybe a child whose parent has set something up for them. There's some resistance there, but I believe it's up to the clinician to figure that out and to work with that person, meet them where they are, and to work that out. Kind of the same thing like you do. You look at a face, you meet it where it is, and you improve on that.
Right.
Same thing.
Right. They have to be ready for therapy. You know, you can't force them to go.
Absolutely. Yeah. You won't get the results that you need if that doesn't. But it's also up to the therapist to develop a true rapport with their client.
Yeah, the trust and
absolutely. And that takes time, but it does develop.
You know, you've worked with addiction too.
Yes.
So people, you know, they have the filler addictions or addictions. They come in and they would try to get lip filler every 3 months. And you can't do that. Lip filler lasts anywhere from 8 months to over a year. So because they're starting to see signs of aging and all they want to do is augment the cheeks and the lips. Well, they don't know what's happening is that they're losing volume all through. And so they're worried, they're panicked. So they think that would make them look better. In reality, you know, it's the whole facial global treatment that it's not just 2 areas. That's my job. It's an opportunity for me to educate and tell them that we have to treat the whole face as a whole, you know, as a facial balancing and all that. So tell us about addiction.
Addiction is multifaceted. It depends on drugs. It depends on what the actual addiction is, what type. There's so many variants that go into it. But just like you in your therapy, you know, when someone comes in and let's say they have fuller lips than normal, you're going to have to assess that. They always say that too much of a good thing ends up not being good.
Right.
And it could be. You know, and you say, well, Laura, you know, what is, you know, too much mental health? Is that a possibility? Maybe, maybe not. But again, it's up to the therapist to assess the situation, just like it's up to you as a clinician to assess that person and what they're doing and the reasons behind why they're doing it.
Right. And addiction can be with lip filler, it can be with gambling, drugs, alcohol, you know.
You can be addicted to anything. What we look at is if it interferes with your everyday living, then that's crossed over into addiction. There's the use, abuse, and then addiction. And once you cross that boundary into addiction, you need some help.
So Laura, have you ever had filler or Botox addiction in your clinic?
Currently, I haven't seen any clients that are addicted to Botox or filler. However, with the research and recent trends, it's predicted that we are going to start seeing some more of that. Just with the resurgence of, out of COVID, people do want to look better. We're seeing more and more of that. How I will handle that is that underneath that, there's some other things going on.
Other addictions.
Yes, yeah. And we'll have to really, because, where's it coming from? So I will need to, give some assessments and just to determine where they are. And, of course, then talk to them and figure out where they are and why it's happening, what's going on. Then we can work on the underlying issues. Have you seen anyone that has walked into your clinic?
We haven't, but, like I was saying earlier, it's the facial volume loss that they're trying to compensate by getting bigger lips and bigger cheeks. So that's not really addiction, but it is, So that's my job, to educate them about the facial volume loss and bone loss and things like that. But true addiction, I've had a few, and we just kind of, they really need to see someone like you. Refer them out.
Refer them to me. I'll refer to you. You refer to me.
Because that's something we can't help them with.
Right. Right.
Yeah.
Yes. So I look forward to working through that with the individuals that come in that do have that type of addiction.
Mm-hmm. And then, for us, there's the beauty ratio, the known beauty ratio. So beautiful faces in the world across all ethnicities have vertical fifths and horizontal thirds. And some people are blessed to have been born with it. others, as they age, they no longer have that. So it's my job to help them achieve that. And sometimes they don't have it at all, and they're not born with that. So these are beauty ideals. So, I can help them with that. So in therapy, can you help them with their mental health, with their confidence? I mean, what would that take? How long does it take?
Absolutely. Good question. There's no set time limit. It's going to depend on the client. And of course, the work that they put into it. If they're willing to work and I guide them in through it, yes, you can work on their self-confidence.
Depends on what kind of issue.
Exactly. And it depends on what type of therapy that they actually respond best to. So it just needs to be tailored to the individual client.
That's really nice. Mental health is something that is not measurable. So it's really hard to get to the bottom of it to help. There's medications, there's counseling, there's journaling. You have to do it yourself. You have to be compliant. You have to come in all the time. But people give up. They don't. It's a lot of work, and people don't want to work.
It is a lot of work. Yes, it is a lot of work. I appreciate the clients that are willing to work and want to work. And then I appreciate the clients that don't want to fight work that hard.
But can you get them to that point?
Absolutely. Absolutely, I can.
Yeah, but they have to be willing initially.
They have to be willing and want to. And sometimes they may not be willing and want to. And it's my job to show them what's going to happen when they become willing and want to. Just how things can improve down the road.
Right.
Things can get better. Life can be good.
Just like I'm sure it's rewarding once you see that they've done better, they're out of that space to where they're not they're depressed and they can't do anything,
Yes. My goal has always been to work myself out of a job. That's what I always tell my clients. My job is to work myself out of a job.
You're probably successful in some cases.
Yes, and I just want to be, I'm there for maintenance whenever you need me. Kind of like what you're doing with me, maintenance.
Maintenance. Yeah. So they can go for a few years, and then they still need maintenance treatments.
Absolutely.
Yeah, just like anything else.
Exactly, and I'm, like I tell them, I said, I'm here whenever you need me. Just reach out.
That's really great, yeah. It's rewarding for me, too, when you see someone, that's who's aging, and then you kind of help them, and then you transform them back to the way they were. It's rewarding, too, and you would give them a mirror and they would cry, or tears of joy.
Yes.
And it's rewarding for me as well.
It is. Yes.
There are many people who oppose Botox, fillers, and things like that because they think that it makes them unnatural looking, like I was saying earlier. Good work is undetectable, right? What you're seeing around is just the two placements of the lip filler and the cheek filler. You have to treat the whole face globally, right? So they're opposing, they don't understand, they think that more is not better either. Do you want the perfect, it is a medicine, you want the perfect dose for you, for your anatomy. And then in your case, do you find that they oppose therapy?
Well, I think what you're talking about is the stigma that's associated. People go, oh, if you get filler, oh my goodness, you don't like yourself. Totally not true. People that get mental health, there's a stigma. Like, you don't want to go talk to someone and let someone know that you're having a problem. We have fought long and hard trying to, overcome that type of stigma. And we're making grounds. A lot of time now we're seeing that it is, people are talking about their therapist.
More than ever, they're talking about mental
openly
illness.
Talking about,
and they're trying to get help.
Exactly. Talking about, their issues, what's going on. This causing me anxiety. I'm depressed over this. And people are talking about it now. And again, I think COVID really opened that up because people had to talk about their mental health and what was going on with them because it was nationwide. And so it changed a lot of verbiage that people use and
the way we think.
Exactly. And changing that stigma associated with it, I think it's going to be increased success, and same thing for you.
And with mental illness, it's not measurable that you take this medicine, well, though there's medicine that is, you're going to be like this. It's not like that, you know. So therapy is super helpful with mental illness. You need someone to talk to. I mean, instead of a therapist, you could talk to your friend, but the friend is not licensed, and she can't really help you the way that a trained professional can help.
You're going to want a therapist that is licensed.
Absolutely.
And has the credentials that you need. A lot of times you can go and look on, you know, like Psychology Today, you can go and look on a website and see what their specialties are. And then, like I do, I always offer an initial consultation. Let's just do a short introduction. Let's see if we get along. Let's see
if they're a good fit.
If it's a good fit, what your needs are. Let's talk about treatment programs real quick. And then if we want to proceed forward, then we have a formal meeting.
Right, right. And same with us, you know, when they want to find an injector, make sure that the injector is licensed, board certified, you know, who has a lot of experience, who's a trainer for a company. That would be nice too.
Yes.
I don't want to say anything.
Who could that be? I don't know.
Just someone, you know, who's mindful, who's prudent.
Yes.
You know, with patience, with the craft, and just overall patient care, because it is, after all, patient care.
It is, and always staying current on any new research out there, because research, it's new. We find it every day in your business and mine too.
Yep.
Because
current. Aesthetic medicine is so new that what we did 10 years ago, we don't really do it now. We enhance it. We do it better.
Yes, exactly.
Yeah. You know, we turn people away as a provider because if they're not a good fit for us, if they are unrealistic expectations, they have body dysmorphia, you know, they seek out aesthetic treatments to completely change themselves instead of enhancements, you know.
Right.
Then I'm not their provider. They need to find someone else that aligns more with their beauty ideals, because I'm more natural, you know, enhancements. So I'm sure it's the same way with you, right?
It is. You know, you need to make sure that, you know, the clients that I'm working with, that it's in an area of expertise that I have. And just like with you, you need to make sure that the clinician fits the client.
Right.
Very important.
The trust and the rapport, and
there is. It's an element, and you know, there's a reason why I continue to come back to you over and over again. We've definitely developed that trust.
Absolutely.
And
well, you're a joy to see all the time anyway. So
yeah, I can come in and say, Tama, what do you think? And I trust you to let me know and to do that.
Oh, thank you.
So, yeah.
You have anything else to add to addiction?
Just to make sure that you ask the correct questions. Make sure that you have someone who matches what you're going to need and want. And sometimes those needs and wants change along the way, but you need to be able to work through that.
Yeah. And then you have a website, right?
I do. You can contact me, Psychology Today, and just, you know, do a name search, Laura Bryan, and you'll be able to find me that way. Yeah,
so you guys want a session with Dr. Laura Bryan, you can go on her website, psychologytoday.com. And if you guys want a consultation with me, lilymetspa.com. Okay, yeah. Thanks for coming today. I've learned so much from you.
Thank you for having me. Loved it.